Good morning and welcome to day two of Health Security Week at our October Action Summit for Women Legislators. We have another great lineup of speakers and practitioners for you today. But first, to kick off our second day of Health Week, we'll hear from U.S. Congresswoman Lauren Underwood, who is one of three nurses now serving in the U.S. House of Representatives. Congresswoman Underwood serves Illinois' 14th Congressional District. She is the first woman, the first person of color, and the first millennial to represent her community in Congress. She is also the youngest African-American woman to serve in the United States House of Representatives. She co-founded and co-chairs the Black Maternal Health Caucus, which elevates the Black maternal health crisis within Congress and advances policy solutions to improve maternal health outcomes and end disparities. Prior to her election in Congress, she served as a senior advisor at the U.S. Department of Health and Human Services, helping to implement the Affordable Care Act. We seriously could have had a better speaker and leader in Congress for our Healthcare Week, and we're thrilled she was able to submit remarks. So without further ado, here's Congresswoman Underwood.
Hi, everybody. I'm Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. I'm delighted to be joining you for the October Action Summit for Women Legislators, and I'd like to begin by thanking the leaders of the Women Legislators Lobby for inviting me to join you and so many distinguished women in public service across the United States. To the state legislators who are participating in this summit, thank you for the tireless work you do in your communities. For your communities, every day. While the national news is fixated on the drama of debates in Washington, so many of the policies that most directly and significantly impact the lives of American families are drafted, passed, and implemented at the state level. And there are few policy areas that touch people's lives in a more meaningful way than healthcare. As a registered nurse, I came to Congress with an understanding of how critically important it is for people to have access to high quality, affordable care. That's why one of the very first bills I ever introduced was the Healthcare Affordability Act, which provides tax credits to guarantee that no American will pay more than 8.5% of their household income on healthcare premiums. And thanks to a 2-year version of my bill that was included in the American Rescue Plan Act, we've cut our nation's uninsured rate, provided substantial savings for individuals and families, and taken the most significant step towards health equity since the Affordable Care Act was signed into law. Through the premium tax credit expansion that I championed, millions of Americans have been able to enroll in coverage, some for the very first time in their adult lives. Marketplace enrollees are seeing savings of more than $40 per person per month, a 40% reduction in their monthly spending on healthcare that means more money for groceries, school supplies, and essentials that families depend on. Median plan deductibles for new enrollees have dropped by nearly 90%, from $450 to $50, and half of eligible uninsured Hispanic adults and 45% of eligible uninsured Black adults are now able to find a $0 premium plan. We cannot let these gains expire, and that's why I'm working to make this historic healthcare coverage and affordability expansion permanent in the Build Back Better Act. Doing so will help individuals and families, and it could also be a major step for state governments like California that have created their own marketplaces, and now will be saving more than $700 million from my legislation included in the American Rescue Plan. We know the mission to ensure that every American can access high-quality care is not a task for the federal government alone. In so many states across the country, legislators like you are advancing innovative solutions to lower costs, promote continuity of coverage, and improve health outcomes. One example that I'm particularly proud of from my state of Illinois is related to the urgent issue of maternal health. As many of you may know, the United States has the highest maternal mortality rate of any high-income country and the only rate that's rising. There are also stark racial and ethnic disparities. Black and Native Americans die from pregnancy-related complications at 2 to 4 times the rate of white Americans. And research has shown that maternal morbidity and mortality rates are also elevated for Hispanic, Asian American, and Pacific Islander people. To address this crisis, we need a comprehensive policy response. And one of the single most impactful steps we can take is to expand postpartum Medicaid coverage from 60 days to 1 year. Currently, people who become eligible for Medicaid during pregnancy lose their coverage 60 days after the end of their pregnancy, even though the evidence tells us that nearly a quarter of maternal deaths occur more than 6 weeks postpartum. When people lose coverage in the postpartum period, they lose access to doula services, mental health care, contraception, and treatments for chronic conditions. That's why state maternal mortality review committees, medical and nursing associations, and maternal health policy experts across the country all recommend extending postpartum coverage to 1 year. And in April of this year, Illinois became the first state to do just that by obtaining a waiver I helped secure through the Centers for Medicare and Medicaid Services to expand postpartum coverage. This historic step will literally save lives, and I hope that we're the first of many states to take this urgently important action. I know that many women legislators in many other states are engaged on the issue of maternal health as well, including in California, where a bill known as the California Momnibus Act was recently signed into law. I was excited to see the state-level maternal health package get enacted, and I look forward to building on the momentum in the United States Congress, where I am the lead sponsor of the Black Maternal Health Momnibus Act. My legislation is a sweeping package of 12 bills to target the clinical and non-clinical drivers of maternal mortality, morbidity, and disparities. These investments were included in the Build Back Better Act legislation that advanced in the House of Representatives, and I look forward to working with my colleagues to get this package signed into law. Through efforts like these at the state and federal levels, we can take the bold action that will be required to save moms' lives, end racial and ethnic disparities, and ensure that every family can thrive. So thank you for your commitment to this work, and thank you for all that you do to uphold the fundamental right of healthcare in the United States. I look forward to continuing to work with all of you in the months and years ahead. Thank you again for the opportunity to join you for this summit, and take good care of yourselves.
Good morning, all. Thank you for that great kickoff, Congresswoman Underwood. Today is another fantastic day of Healthcare Week, all part of our October Action Summit. And I am fortunate enough this morning to introduce you to WAN's founder, Dr. Helen Caldicott. We were fortunate enough to have a really long and interesting conversation with her recently that she allowed us to record. So we've put together some comments from her that I think she really wanted you all to hear. I think you'll find inspiring, enraging, but she is every bit the activist she was when she first started working on anti-nuclear issues in the 1970s. So please welcome Dr. Helen Caldicott.
I'm Dr. Helen Caldicott. I am a pediatrician, and my specialty is cystic fibrosis, the most common fatal genetic disease of childhood. 1 in 25 Caucasians carry the gene for CF. In the late 70s, I was working at Harvard Medical School on the faculty in the cystic fibrosis clinic. And I was invited to speak both in Hiroshima and Nagasaki on those commemorative days about what happened when the bomb dropped. But to go back further, when I was quite young, I lived in Melbourne, Australia, and I read a book by a man called Neville Shute called On the Beach, and it was about a nuclear war that occurred by accident in the Northern Hemisphere, and gradually the radioactive cloud came down to the Southern Hemisphere and down to Melbourne, where I lived. And people were preparing to die. Men were having their last gin and tonic in the Melbourne Club. The government dispensed cyanide capsules so that the people could kill their children without going through the agonizing symptoms of acute radiation illness. And at the end of the book, everybody was dead in the world. I was only about 17 when I read that book, and that marked my soul. I lost the innocence and joy of adolescence. So all my life, I'm now 83, I've been deeply concerned about the prospects of nuclear war. So that at the end of the 70s, I wanted to start a new party called Women's Party for Survival, Women. And people said, in America, you're mad, you can't have another party. We've only got 2 parties. Through the retrospectoscope, I wish I'd stuck to that conclusion, but in fact, we called it Women's Action for Nuclear Disarmament. And it became very, very powerful because women understand, as you legislators know, more about life than men. For me, it's time now that women took over the world. And the reason I'm saying that is that there are 9 countries now that have nuclear weapons. We're closer to nuclear war than we've ever been, according to the Bulletin of the Atomic Scientists. They put their doomsday clock recently to 100 seconds to midnight, and that's the closest that clock's ever been to signaling the end of life on Earth. No one talks about it, and the men are intent on building more and more weapons. Congress votes for every weapon that comes down the pike. They are being funded by the military-industrial complex, and they vote for weapons for mass destruction and for killing. In my mind, as a doctor, it's not the Department of Defense at all. America has no enemies, but it contrives enemies to keep the military-industrial complex going. And now that Afghanistan is over, guess what they're dreaming up now? China, which is absolutely ridiculous. And let me read you this. Boeing, which is one of the major military contractors, spent $15.6 million lobbying and was awarded $105 million for nuclear weapons work. This was in the last year. Lockheed Martin spent $15 million lobbying and was awarded $2.1 billion for nuclear weapons. Northrop Grumman spent $13.3 million lobbying and was awarded $13.7 billion for nuclear weapons work. And Raytheon Technologies spent $15.2 million lobbying and was awarded $450 million for nuclear weapons work. Now that's mainly why the Congress, both Democrats and Republicans, vote for any weapon that comes down the pike. And it really is ludicrously wicked. The other thing is that these corporations are very clever and they've built their factories in every congressional district. So therefore, when Congress people and senators try to cut off these funds, they scream jobs. And of course, you know, I don't call it the Department of Defense anymore. It's the Department of War, but more, to be quite frank, from a medical perspective, it's the Department of Killing. I just can't stand the thought, having spent my life taking the Hippocratic Oath and trying to save lives, that we kill people. And when you really look at war and what's happened in Afghanistan, Syria, Yemen, Libya, and the like, Iran, Iraq, it's human butchery, and it's time that we stopped fighting and killing. Women have to make a stand. America has no enemies. What we must do now in the world, when we're facing the climate crisis and the earth is heating up inexplicably fast, and millions will die and we'll have millions of ecological refugees, what we must do now is make friends with everybody and help all the countries with this money rather than spending it on weapons. And many people in America call themselves Christians. Thou shalt not kill. Now, I want to just describe to you, well, first of all, I want to read out who's got bombs. The United States has 2,800 nuclear weapons with a total inventory of 5,500. China only has 350, India 150, the UK 225, Pakistan 165, France 540, Israel 80, but I'm sure there are many more. North Korea 10 or 20, Pakistan 165, Russia 657, of which 1,760 are retired. But let me tell you that 1,000 nuclear weapons dropping on 100 cities will create nuclear winter and the end of life on Earth. 1,000. And I just read out to you how many weapons there are in the world. 1,000. Because as the cities burn and oil wells burn and petrol refineries burn, huge clouds of toxic black smoke rise up into the stratosphere, will cover the Earth with a cloud so thick, will block out the sun for up to 10 years and cause what they call nuclear winter, where we and all organisms on Earth, plants and animals, will freeze to death in the dark. Freeze to death in the dark, and that'll last 10 years. Now, I want to read to you how this works. And we live every day with the threat of total nuclear annihilation, and no one's attending to it. All the money is going to more weapons, more wars, which will provoke or easily could provoke a nuclear war by accident or design. So some years ago, America launched a weapons satellite from Norway that told the Russians this was going to happen, but the Russians lost information. And when Russia picked up this rocket, they thought that America had launched a first strike nuclear war, and they were ready to launch their nuclear weapons. That sort of situation occurs not infrequently. I don't know, to be frank, how we're still here. So let me read from my book, The New Nuclear Danger. If launched from Russia, nuclear weapons would explode over American cities 30 minutes after takeoff. Let me see. It's assumed that most cities with a population of over 100,000 people are targeted by Russia. This is in America. Think of where you live and who you represent. During those 30 minutes, the US early warning infrared satellite detectors signal the attack to the Strategic Air Command in Colorado. They in turn notify the president, who has 3 minutes to decide whether or not to launch a counterattack. In the counterforce scenario that the US government currently embraces, he does launch, the missiles pass mid-space, and the whole operation is over within an hour. Nuclear war between Russia and America takes 1 hour to complete. Landing at 20 times the speed of sound, nuclear weapons explode over cities with heat equivalent to that inside the center of the sun. Just take this in emotionally. Could happen tonight. There is practically no warning except the emergency broadcast system on radio or TV. You know, you hear, ooh, on NPR. We're just testing the emergency broadcasting system. There's no time to collect children or family members or get it to a fallout shelter. The bombs, because most major cities will be hit with more than one explosion, will gouge out craters 200 feet deep and 1,000 feet in diameter. Half a mile from the epicenter, all buildings will be destroyed, and at 1.7 miles, only reinforced concrete buildings remain. At 2.7 miles, bare skeletons of buildings still stand. Single-family residents have disappeared. 50% are dead and 40% are severely injured. Bricks and mortar are converted to missiles traveling at 100 miles an hour. Bodies sucked out of buildings and converted into missiles, flying through the air at 100 miles an hour. Severe overpressures, many times greater than normal atmospheric pressure, have popcorn windows, producing millions of shards of flying glass, causing decapitations and shocking lacerations. Overpressures enter the nose, mouth, and ears, inducing rupture of lungs and rupture of tympanic membranes or eardrums. I could go on and on and on. This data shows, and it shows that we must produce bilateral or multilateral nuclear disarmament ASAP, with America taking the lead. It's up to women. 52% of the population, we have all the babies. And if we love our children and we love this planet and we love the koalas and the kangaroos, I'm Australian, we will stop this nuclear madness. Please understand how vulnerable we are and how we've got so much ability to turn things around. I started WAND and WILL for this reason. in 1978. I'm glad you're here. If I can help you in any way at all, please let me know.